As COVID-19 spreads across Africa, healthcare facilities across the continent face shortages of basic medical supplies needed to treat the respiratory disease. Not only masks and ventilators, but something people in rich countries take for granted: oxygen. Kenyan doctor Bernard Olayo has worked for years to alleviate the shortage of medical oxygen in his country and across Africa. Today, his company is poised to play a critical role in the treatment of Kenya's growing number of COVID patients.
COVID-19 is here in Africa, and the numbers are going up. My company, Hewatele, is playing a critical role in the management of COVID cases in Kenya. We were approached by the government to scale up the supply of oxygen. Oxygen is very critical. Most COVID patients, if you give them oxygen early enough, then you stop them from progressing into the most critical stage where they require ventilation. We really need to focus on treating people at this very early stage where oxygen can make a significant difference. We did a number of things to ensure that we can meet that expected surge in demand. We have hired more people to operate 24/7 and expanded distribution capacity. When I first started practicing, one of the gaps that I noticed in our health facilities was the lack of oxygen everywhere I went. It breaks your heart because you're deciding who lives and who doesn't live. And no doctor should be put in such a situation. I decided that we needed to do something. We researched, and one thing that became very obvious is way too expensive here in Africa. A liter of oxygen going for 13 times more in Kenya than in North America. There's just one company, one monopoly, and they typically have one production facility that serves a very large area, with some hospitals more than 1,000 kilometers away. With transport costs, it becomes very, very expensive. That is why we intentionally place the plant at the busiest hospital so that we limit the distance needed to bring oxygen to where it's needed the most. And then we distribute it using a milkman model to surrounding health facilities. All that allows us to reduce the total cost of acquiring oxygen by approximately 50%. The goal is that no health worker would ever have to make the painful decision that I did, where you have to choose between who lives and who dies.